I want to understand in today's time, young girls are diagnosed with PCOS or PCOD. But I also understand that endometriosis, the kind of disease it is, the diagnosis may take a lot of time. And hence, the symptoms of PCOS and PCOD and endometriosis are a little bit of an overlap. Hence, is there a way that an individual or a young girl or a mother of a young girl, females around the young girl, can identify maybe this is not just PCOS or PCOD, but a little bit serious than that?
So, Rashi, that's a very intelligent question because, yes, few symptoms of PCOS and endometriosis, they do overlap. So, when it comes to period, delayed periods or irregular periods, so that can be seen in both, the PCOD and the endometriosis. That is true. But the thing which differentiates them is the blood worker. If they get the hormone levels, tested, then they are going to be very different in PCOS, as we say that, LH is increased and FSH is reduced. The ratio gets disturbed in PCOS, which is kind of a hallmark or a diagnostic criteria in PCOS. But in endometriosis, I say, most of the time, like the blood work is normal and even the hormonal profile is normal. The LH-FSH, that ratio is maintained. So before diagnosing a girl as PCOS, we must have a complete blood work, which should be pointing towards that. And if it is not, then it really requires evaluation for other disorders like endometriosis because diagnosis is challenging.
A normal
Yeah.
ultrasound can also help differentiate between both, unless it is lean PCOS, because lean PCOS also doesn't show up in ultrasound.